Okay, here we go. This is part 5. This is on the rotator cuff, and you'll see a ton of stuff in the clinic, in hospitals, nursing homes around rotator cuff issues. And so we're going to spend some time on this, couple of sections here on the rotator cuff. First of all, the rotator cuff muscles, in terms of them getting torn and weak and the kinds of issues with irritation, really kind of comes with age. I read a study where I think it was close to 80 to 90% of individuals, once you're in your late 70s and up, they have some degree of tear in their rotator cuff. Basically, because the shoulder is so mobile, it's not really built to last. And the time you become an older adult, late 70s, 80s, it falls apart. It's just not built to last. It's like a car, at least a car in the old days, 100,000 miles beyond that, it's gonna fall apart. And it's kind of what happens. So you almost can assume, if you go in and see a client in a nursing home or rehab, if they're in their 80s, that they have some degree of tear in the rotator cuff. It may or may not be painful, but it's there. So you definitely want to be careful when you're doing stuff with older folks around their shoulders, because the rotator cuff is probably pretty frayed and damaged in there. We'll talk about that, talk about irritation and tears, and this idea of good guys and bad guys. Just said how it's not built to last. What the rotator cuff does, basically, it's hard to kind of show you. Usually I show somebody with the skeleton. Like we said, it does the internal and external rotation. That's what the job of the rotator, those sits muscles are, those four muscles. The internally rotate it, externally rotate it. Subscap brings it in, internal rotation. Infraspinatus, teres minor brings it out, external rotation. And this supraspinatus abducts. So they're rolling it in and out. And even more importantly, they have a good role, play a big role in the shoulder dynamics, shoulder kinematics, to keep the space. As we'll see, they kind of have a role with the humerus to kind of balance it out so we don't lose that space. If the rotator cuff starts to go, which it invariably does as you get old, you lose the space because that dynamic within the shoulder joints, the kinematics within the shoulder joints, the kinesiology within the shoulder joint is compromised. Rotator cuff tears. These are some good videos of surgery. Usually we watch this in class. I would highly recommend that you do that. You watch this in class, you get a sense of what they do in surgery and how that plays into what you're going to be seeing in the clinic. I saw it when I was a student. It was pretty cool. Usually what they're doing is, that blue right there are stitches, I believe. He stitched it back up. Is it tears? There's the supraspinatus. That one's torn completely off, which is pretty rare. And he's getting some fraying on, which one is this? I believe that is the subscapularis. So he's getting a little bit fraying, tearing there, and that one's completely torn. Could it be trauma? Trauma also can cause tears to the rotator cuff. More commonly, though, it just kind of wears out and kind of it's like a straw that breaks the camel's back kind of thing. Can't tell you how many clients I've had that said, I was just driving and all of a sudden my shoulder felt like it just fell apart. It started to become very painful. Shoulder wasn't bad, and I cast fishing, and then boom, it went. Usually these folks are in the 50s and 60s and 70s. It's been fraying, and then it gets to the point where it just kind of gives, and they have to have surgery on it. And what they're doing with the surgery, they're basically just stitching it up, just kind of repairing in there. Commonly also what they do in the surgery is they go in and they clean out a lot of the bone spurs in here. You don't really see the bursa in here, but the bursitis, they may even take the bursa out. The one I saw, he scraped out the bone spurs. So what happens is the space is compromised. It's pushing, irritating on the bone, and it causes it to grow these little bony growths, these little bumps in there, and that compromises even more space. So when he went in there, he sewed it up where it needed to be sewed, and he just literally scraped out the bones to give it more space to get that good dynamic back. These are grades of tears. You may see those or hear about those. Different surfaces, different grades of tears. You can see how it's kind of fraying and tearing until it gets to this grade 3. And there's a lot of times those protocols around the different grades for exercises and stuff. And then we have this idea of the good guys and the bad guys, which I talked a lot about in the anatomy lecture. Again, make sure you listen to that, it's very important. The good guys, they're the ones that open up the space, give that good space and flow. Which ones are the good guys? These are the ones you want to work on in therapy, the ones you want to strengthen. So you're strengthening these, and then the bad guys, you're calming them down and stretching them out because they're tight and sore. The good guys, external rotators, teres minor, infraspinatus, rhomboids, scapular retraction. A lot of these other ones push the scapula down, bring it into place. And then the bad guys, the ones that are always sore and irritated. The subscap, pec minor, pectoralis major, anterior deltoid in situations. They're too tight, too sore, impairing the space and flow. So these you strengthen, these you stretch out, calm down with modalities, manual therapy. Okay, so I'm going to end this and go right to the treatment box. Pull that up. There's 2 things to pull up: the rotator cuff bursitis treatment box, and the evidence-based practice for the rotator cuff surgery protocol. Because you can see you may get a rotator cuff surgery, you might want to know what to do. This will give you some